The other day, among several people in the comments of the channel, a debate was established about which was worse, parvovirus or distemper. And I thought it was a good excuse to refresh our ideas, our memory, about the importance of both diseases, how they can be treated, what are the characteristics of each one, and, in short, what you should do if you suspect that your dog has parvovirus or distemper. Look, both diseases, parvovirus and distemper, are viral diseases. So, a priori, there is no medicine that you give to the dog, and the dog is cured. There is treatment. Mind you, I am not saying that the disease cannot be cured. But it must be said, there is not, as with bacteria, a drug that you give it, and the virus dies. Point number 1. What do the two viruses look like and how do they differ? Well, basically, the main characteristic of the parvovirus is that it's a very tiny virus, much smaller than the distemper virus, and it resists in the environment for up to 2 years. And besides, you can't disinfect it with almost anything. Don't throw bleach on it, it's not going to work. The virus will still be there. You have to resort to livestock disinfectants, glutaraldehyde, formaldehyde, and others to eliminate it, if you want to get rid of it first. If you do nothing, the virus will be present for at least 2 years. In the case of distemper, it will not. The distemper virus is a virus very similar to other viruses that are transmitted through the respiratory tract, which is carried in droplets of microdroplets of water, and its persistence in the environment is of hours. After a few hours, the virus dies. So, is it more dangerous to be infected by one or the other? Well, it depends. The problem is that parvovirus attacks the puppy, at a very tender age. Basically because the contagion occurs by maternal-fetal transmission, by contact of feces and so on, and it is a virus with a very dramatic symptomatology, because it affects the cells of the intestinal mucosa, causing the rupture of the viscums, and the most characteristic symptom of parvovirus, which is hemorrhagic diarrhea. That you see that all of a sudden the puppy starts bleeding from the poops. Of course, this is very spectacular. This is tremendous. When people see it, it's impressive. The first time you see it, you say, fuck, my God. How can so much blood come out of such a small animal? And the treatment, in the case of parvovirus, will be focused on treating this diarrhea. Puppies do not die of parvovirus. They die of blood loss and fluid loss caused by parvovirus. They also have vomiting and so on, but the major blood loss is from diarrhea. So, the treatment that we do in the clinics is basically to go treat the symptomatology. We don't do magic. We also give an antibiotic to cover our health. Because of course, if you have intestinal villi, if you have broken villi, bacteria can enter the bloodstream and septicemia can occur. Okay, but everything else, fluid therapy, antipyretics, and so on. Therefore, it is a treatment that you can do at home. Here I explain, well, it is not going to be the same as what we do in a clinic, okay? Don't let anyone criticize me, but these are home remedies, things you can do at home that will help you to save many dogs. You will see. In this video, I put a whole set of remedies that basically what I try to explain in this video is to reproduce what we do in any veterinary clinic. Rehydrate, cut the vomit, cut the diarrhea, etc., period. The advantage of parvovirus is that it doesn't mortality is very high. Nobody says otherwise. Dogs can die in 4 or 5 days. But fortunately, it is not a disease that leaves a lot of after effects. The animal can recover more or less well. Let's talk now about distemper. Distemper, as I have already said, is a more labile virus, easier to attack by any disinfectant, but it is a very nasty virus. It must be said, it is a virus that does not show its face. At least the parvovirus is honest. It attacks and beats you. This one doesn't look like it. It doesn't look like it. The puppy has symptoms at the beginning that are just a little bit of mucus, a little bit of a sore. You think it might just be a little cold and it's not. The animal is infected with distemper. And this, for me, there will be a veterinarian who will tell me no, and I respect that. Nobody here is in a position of truth. For me, it is a worse virus, because, as I said, It is a more treacherous virus. It's a very bad virus, and you have to be very careful because, as I said, the virus doesn't show its face. It hides. It disappears. You do a test, and you don't find it in your blood, and you say, holy shit, it's not there. What happens is that the virus leaves the blood and goes to the central nervous system. There are times when dogs even seem to have recovered. Not in the case of parvovirus. In the case of parvovirus, diarrhea, and blood enter. I tell you, very complicated. Anyway, as there are many new treatments for this disease, not long ago we made a video. It is a long video. Sorry, an hour and a bit. But where I tell you everything you have to do to save the life of a dog with distemper. Because the difference is that not only does it kill many, but many of those who survive, if not all of them, are left with very serious sequelae. Okay? That's all. This video on distemper is very important. Listen to me. That's all. Thank you very much, and see you in the next one. Take care. Bye.